Multiple sclerosis is by far the most common neuroinflammatory disorder in Western population. It's a chronic T-cell mediated autoimmune disease which causes inflammation within the white matter of the brain and spinal cord, specifically in myelin and oligodendrocytes. Multiple sclerosis is the most common chronic central nervous system disease of young adults in between 20 to 30 years of age. However, it's more commonly seen in women. Presentation after 60 years is quite rare. It's associated with HLA-DR2 gene variation, and it's more commonly seen in the population who live in the regions away from the equator. The demyelinating plaques can occur anywhere in the central nervous system white matter, but they have a predilection for distinct sites like optic nerves, periventricular region, corpus callosum, brainstem and its cerebellar connection, and the cervical cord. These patients will present with relapsing neurological deficits with periods of remission. This is also known as dissemination of time and space, and it's a characteristic of multiple sclerosis. There's a wide variety of possible symptoms depending on the anatomical site of the lesion. If the lesion is in the optic nerve, the patient can have blurred vision in one eye. If the lesion is in the brainstem, they can present with vertigo and scanning speech which mimics the alcohol intoxication. If the lesion is in the medial longitudinal fasciculars, they can present with internuclear ophthalmoplegia. If the lesion is in the cerebral white matter or the periventricular region, they can present with hemiparesis or unilateral loss of sensation. If the lesion is in the spinal cord, they can present with lower extremity loss of sensation or weakness. And finally, if the lesion is in the autonomic nervous system, they can present with bladder bowel dysfunction and sexual dysfunction. So what are the clinical categories of multiple sclerosis? There are 4 clinical categories: relapsing and remitting, secondary progressive, primary progressive, and progressive relapsing. Relapsing and remitting is the most common type of multiple sclerosis. And in here, the symptoms occur in attacks with characteristic like course. So they'll have episodes of acute worsening and recovery and a stable course in between the relapses. In secondary progressive multiple sclerosis is a late stage which consists of gradual worsening disability progressing slowly over the years. So in here, the neurological deterioration can occur with or without superimposed acute relapses in a patient who previously had relapsing and remitting multiple sclerosis. In primary progressive multiple sclerosis, there's gradual worsening without relapses or remissions. Progressive relapsing multiple sclerosis is similar to primary progressive multiple sclerosis, and in here there's a gradual neurologic deterioration from the onset of symptoms but with a subsequent superimposed relapses. Now let's talk about investigations. Purpose of investigation is to provide supportive evidence of dissemination in time and space, and to provide evidence of immunological disturbance. The diagnosis is made by doing an MRI and a lumbar puncture. The MRI reveals plaques, which are the areas of white matter demyelination. In the lumbar puncture, the total protein concentration could be raised in 60% of the cases, with an increase in the level of immunoglobulin G in 40% of cases and oligoclonal IgG bands in 80% of the cases on electrophoresis. Visual evoked potential or VEP may show prolonged latency in cortical response to a pattern stimulus, and this indicates a delay in conduction in the visual pathways. Blood tests should also be done to exclude other inflammatory disorders like sarcoidosis and vitamin B12 deficiency. In the treatment of multiple sclerosis, the treatment of acute attacks includes high-dose steroids. Long-term treatment with interferon beta-1a and 1b slows the progression of the disease. We can also add immunosuppressive drugs too. Apart from that, we have to think about symptomatic treatment of urinary symptoms, spasticity, pain, depression, impaired mobility, erectile dysfunction, tremors, and fatigue. So what are the prognostic markers that predict the severe multiple sclerosis? Progressive disease from the onset of symptoms, frequent relapses in the first 2 years, motor and cerebellar signs at presentation to the neurologist, short interval between the first 2 relapses, male gender, and poor recovery from the relapses. Women and patients with predominantly sensory symptoms and optic neuritis have a more favorable prognosis. And that's all about multiple sclerosis. You can support my channel by simply clicking the like button, commenting and subscribing to my channel. Thank you for watching and I'll see you again with another interesting video like this.